Good morning, everyone, and welcome to Congresswoman McBath's Women's Equality Day webinar. My name is Abigail, and I have the privilege for working for Congresswoman McBath here in her district office in Sandy Springs. We're so glad all of you have joined us this morning, and with that, I'll go ahead and kick it off to you, Congresswoman.
Well, thank you so much, Abigail, and I'm so excited this morning, a gathering of women on Women's Equality Day. I couldn't be more excited to have the phenomenal women that we're going to be speaking with today. Laura Colbert, I'm so excited. And I do have to say though, we have one individual that we're trying to make sure that she's going to be able to join us. This will be Terry Dennison. We're having some technical difficulties, so she'll be joining us just momentarily. And then also Kathleen O'Laughlin. Really excited today on this very, very special day, particularly for women, to be talking about things that are specific to us and making sure that we're healthy and whole and taking care of our families, but most importantly, making sure that we're taking care of ourselves. Happy Women's Equality Day. Thank you so much for being with us today to spend some time with my office and the experts that we have gathered today for you. As we learn more about federal services that are available for women in Georgia. Just last week, my House colleagues and I, we celebrated the anniversary of the ratification of the 19th Amendment, which gave women the right to vote. Today, we celebrate both Women's Equality Day and the 100th anniversary of the certification of the 19th Amendment. And today we celebrate 100 years of women's suffrage. Women have made such incredible progress in the last century. And there is no question that women will continue to lead. We will continue to lead and we'll continue to create and we'll continue to inspire in the 100 years to come. And I'm not sure how many of us will be around the next 100 years, but we're going to make it better for all the women that come behind us. While we celebrate today, may we also remember that there's a great deal of work yet to be done to achieve a full measure of equality for women in America and also around the world. Women still face barriers and challenges that they must overcome, that they struggle to overcome each and every single day. And that is one of the reasons why I convened this morning's webinar to educate women and to empower women and to ensure that every person is able to take advantage of the opportunities and resources designed to help them succeed. That's truly important, especially at a time like this with the onset of COVID-19. Today, I'm joined by three experts who represent a variety of federal services for women in healthcare, business, and veteran services. We're going to hear from them about the specific services that their agencies or organizations provide and how women can be ensured that they're plugged in to the vital resources and services that they need to remain safe and healthy and successful during this ongoing pandemic. Before I introduce our three experts, I'd like to thank them all for their sustained engagement with my office over the last 6 months. They worked very, very closely with us, and I just couldn't be more grateful for their assistance. One way or another, each of these women have already participated in webinars that we've had in the past, telephone town halls, or roundtable discussions that we've had, and my staff that we've had during the mitigating the pandemic these last 6 months. I appreciate each and every one of your commitments, all the commitments that you've made towards us and to the residents of the 6th Congressional District, serving our residents across the entire state of Georgia. You continue to do that as well. Our first guest is Laura Colbert, Executive Director of Georgians for a Healthy Future. But at this time, as I said, that Laura is, oh, excuse me, I'm sorry. Laura, you are with us, that's right. I'm thinking of the other individual that we're going to bring in just a few moments. But Laura, thank you so much for being with us here today. You're going to talk about some of the unique challenges and circumstances that women in Georgia face, including when it comes to Medicare and Medicaid. And Laura, thank you so much for being with us live today. I really appreciate you and look forward to hearing what you have to say to our constituents.
Thank you, Congresswoman. I really appreciate the opportunity to be with you all today. I run a nonprofit called Georgians for a Healthy Future, and we do advocacy and policy work in order to try to make Georgia's and the US's laws and systems create a better healthcare system so that all of us have affordable, accessible, high quality care so that we can be healthy as women, and also so that we can contribute to the health of our communities. So I really appreciate the opportunity to join with you all this morning as part of Women's Equality Day. As women, we know that we are often kind of the engines behind progress in our communities, and if we aren't healthy, then we know that the health of our community will also suffer. Next slide, please. The slide in front of you, health insurance is very complicated, as you all might have heard. And I wanted to let folks on the webinar know today that they can go find this information on our blog. So if you go to healthyfuturegA.org and search health insurance options COVID-19, it'll pull up essentially a blog form of what I'm going to talk about today. So I'm going to run through some things pretty quickly to make sure that my fellow panelists have enough time, but I want you all to know that if you need a little more information or just didn't quite catch something, that it's available so that you can find it. Next slide, please. So in the US, the way that we all get health insurance is through these kinds of pathways. So under the Affordable Care Act, most of us still get our health insurance through our jobs. There's also the Affordable Care Act's individual health insurance marketplace. And then there are a number of public health insurance options, including Medicare, TRICARE for veterans, PeachCare and Medicaid for kids, and Medicaid in some limited ways for Georgia adults. Now, as soon as I start talking about health insurance, some people have their eyes glazed over, and I totally understand why. It's about as interesting as taxes. But health insurance is really important because it helps folks and women and their families access healthcare services more easily, but it's also an important economic protection. It really helps to protect our finances so that we can better predict what our spending will be, set aside savings for our kids to go to college, or for those home improvements, or just that long weekend that maybe we'll be able to take after COVID-19 is over. So health insurance is really important, and it's definitely something that, if there's a way to fit it in your household budget, you should definitely do so. Next slide, please. And one more. So during COVID-19, there is obviously a lot of job loss happening in Georgia. We've seen 3.4 million filings for unemployment. Because the US's insurance system is very tied to employment, that means that not only are people losing jobs or losing incomes or seeing reductions in their income, but they may also be losing health insurance. And that may be the case for some of you on the webinar today. The good news is that because of the Affordable Care Act, most Georgians are eligible for some kind of other coverage. So about 80% of Georgians who lose their health insurance after a job loss can either get Medicaid or a financial help through the Affordable Care Act. And then there's also still Affordable Care Act health insurance without financial help for some folks whose incomes are still a little too high. And then I'll talk about some folks who can fall in what we call the coverage gap. There are still health insurance options for folks who can't find health insurance, or excuse me, health care options for people who can't find health insurance. So if you are one of those, stick with me, and I'll list some of those towards the end. Next slide, please. So again, after you, if somebody or if you have lost a job, or even just seen a reduction in your income at your job, so if you're working, at a restaurant, and you've seen, and you're still working some hours but not as many, there are likely health insurance options for you. Again, the Affordable Care Act, Medicaid, and then COBRA in some cases, and I will touch very briefly on COBRA. Next slide. So the first one I want to talk about is Medicaid and PeachCare for kids. Medicaid is really important because it is a public health insurance option. It covers half of kids in Georgia and also half of our births in Georgia. So it's a really critical piece of our healthcare system. And there are really high satisfaction rates for people who have Medicaid coverage, either for their kids or for themselves. Folks who are going to be most likely to qualify for Medicaid are, again, kids in Georgia, pregnant women, people with disabilities, or very low income parents. The income eligibility for Medicaid and PeachCare, or excuse me, for Medicaid for parents is very, very low. So, but it is worth taking a look at if you're a parent, especially if you've lost all of your income during this time. You can enroll in Medicaid and PeachCare at any time at gateway.ga.gov. You can, again, Medicaid and PeachCare eligibility is really based on monthly income. So we have those monthly income charts on our website. I didn't put them in the slide set today because like for kids, it's different from pregnant women. So I didn't include them all today, but you can definitely find them on our website if you feel like you might qualify. The important thing to know about Medicaid and PeachCare, next slide please, is that, well, there are a number of important things to know, but eligibility is based on your monthly income. So again, if you've lost all of your income and you have kids, it is a good time to try to enroll them in Medicaid or PeachCare. Because once you get them enrolled, they can't be disenrolled, or yourself, if you also qualify, you cannot be disenrolled from Medicaid during the public health emergency. Normally, again, because it's based on your monthly income, if your income goes up next month, normally you would then have to move to a different health insurance option. But because of the national public health emergency, no state is allowed to kick people off of Medicaid. So once you get your kids or yourself enrolled, you know that you can count on that coverage until the end of the public health emergency. Also, there's no copays or premiums during the national public health emergency. Those are really very low anyway outside of a public health emergency, but right now there are zero premiums and copays. And again, Medicaid covers your testing and treatment for COVID-19 if that were to happen. Next slide, please. If you're already covered by Medicaid and you've had some problems with it during the public health emergency, I included this slide because there is free legal assistance. Medicaid is very complicated. As we know, sometimes our government agencies are not as responsive as we would like them to be. So the folks at Atlanta Legal Aid and Georgia Legal Services are here to help. So I wanted to include those phone numbers in case folks on the webinar need a little bit of help. Next slide. And I'm not going to go all the way through this slide, but I mostly wanted to just recognize that Medicaid has been a real first responder during COVID-19. It is one way that Congressman McBath and our other senators and representatives in Washington, D.C. have sent states additional funds to help with budget shortfalls during this time. It has covered the cost of testing for uninsured, and it has really increased access to care in the midst of this pandemic. So Medicaid has really, really been an important part of our COVID-19 response. Next slide. So now I'm going to shift gears a little bit. For folks who don't qualify for Medicaid, the Affordable Care Act is a really important option, or a really great option. The important thing to know here is that there is a time limit to when you can enroll. So for folks who have lost their job-based coverage, you only have 60 days, about 2 months, to check to see if you qualify and to get enrolled in a plan. So it's important to act quickly. 9 out of 10 Georgians qualify for financial help. So if you think that it's going to be too expensive, it is very worth going to shop around and seeing what your options are, because most people are surprised to find out that they can get financial help. Again, this is private insurance coverage, similar to what you would have at your job. So it does cover COVID-19 testing and treatment, and there is free local enrollment help available. We really like to send people to Insure Georgia. They're a nonprofit insurance agency, and so we really trust that they're helping folks make the right decisions. So, so that is one resource, but you can also find other free local enrollment help. Next slide. I did include some incomes here. Again, there's financial help to lower monthly premiums, and to lower deductibles and copays. And so if you, depending on your family size, if your income falls within these ranges, you may qualify for financial help. And again, most Georgians will, so check to see if you qualify. Next slide. And this is just a few tips on how to estimate income. For the Affordable Care Act, your income should be estimated on an annual basis, which I know is confusing because Medicaid does it by a monthly basis. But this is just a little bit of guidance. If you get enrollment help, your enrollment assister will also be able to help you estimate your income. So you don't have to memorize this. And again, it is on our blog. Next slide. And finally, I wanted to touch on COBRA. COBRA is often surprisingly expensive. I think folks are a little bit shocked sometimes when they see the sticker price for their COBRA insurance. COBRA is, again, just a continuation of your current job-based coverage, except your employer stops paying for their part of the coverage and you are responsible for all of the costs. It is expensive, so usually you can find a better deal on the Affordable Care Act marketplace, but I wanted to put this up here because it might be a good option if you really need to keep your current provider for some reason. If you are 6 months into your pregnancy, you may really want to hold on to that OBGYN you've been going to, so keeping your coverage through COBRA might be a good idea. Or if you have a chronic condition, if you're really, if you've just gotten your diabetes under control, then you may want to hold on to that coverage so that you can keep going to your same provider. Next slide. And then lastly, there are some folks who are going to fall in this gray box towards the bottom that we call the coverage gap. Next slide. So in 2012, the Supreme Court provided states the option rather than the requirement to expand their Medicaid programs to cover low-income adults. So for that reason, we've got some low-income Georgians who do not qualify for either Medicaid or the ACA marketplace. Next slide. So folks in that situation, or if there's another reason you can't find health coverage, I wanted to make sure that you know that you should not forgo seeing the doctor. If you need to see the doctor, there are options for you. There are community health centers and charity clinics. You can find those locations here. They will offer free or sliding scale fees depending on what you can afford. And there's also a company called givinghealth.org, which is offering telehealth services. They are doing mental health services as well as other kinds of services, again, for free or very low cost. And then there are financial assistance programs at your hospitals if you need kind of more than primary care or more than kind of mental health services. Next slide. And then finally, please, just stay in touch with us. Again, we do a lot of advocacy work at Georgians for a Healthy Future, and we want you, to be up to date about the laws and policies that might impact your health care and health coverage. And we need you to help us advocate for, for the laws and policies that will help you and your family afford accessible health care. And last slide. And with that, please get in touch if you have any questions.
Thank you so very much, Laura. That was very comprehensive. And thank you so much. A wealth of information for our guests that have joined us today. Thank you so much for that. Oftentimes I say that it's not that help is not available, but it's oftentimes people just don't know where to find it. So thank you so much for giving us great insight. Next, we will speak with Kathleen O'Loughlin. We'll hear from her. She's the Women's Veterans. Oh, did I go out for a second? She is the Women's Veterans Manager for the Atlanta VA Health Care System. Kathleen is going to offer her perspective on some of the challenges that women veterans face and the many resources that the Atlanta VA makes available to women who served this nation, who put their lives on the line. And so, Kathleen, thank you so very much for being with us today. We're really excited to hear from you as well. I know veterans are really hold a special place in my heart. I come from a family of veterans. My father, my oldest nephew, my oldest brother, and a first cousin. So thank you so much for sharing your wisdom and information with us today.
Thank you so much for having me. I really enjoy being able to talk about our women veterans. So I am Kathleen O'Loughlin. I'm the Women Veteran Program Manager here at the Atlanta VA. And some people don't know, but the Atlanta VA has more women veterans enrolled in care than any VA in the nation. So we have over 20,000 women enrolled in care. So what's important, anytime I get an audience, I always want to talk about the women veteran population. It's a very diverse population. Women have served in the military in different capacities as long as the military has existed. And sometimes when we think about veterans, we think about men, and we don't think about the women who served. So thank you for this opportunity to really talk about those women and to highlight some of the issues that impact them and some of the resources that we have. So I wanted to talk just quickly about how this pandemic is impacting women in general. I like that we're celebrating women equality, and one thing that we do know is there still is a disparity, a gender disparity for women with health and with lots of other issues. So we are seeing in the women population in here with our women veteran population that with the pandemic, there seems to be even more pressure on women in their role. Some of them are single head of household, and so now they're faced with, if they have job loss, the impact that has financially on taking care of themselves and their family. Their children having to be home, schooling from home. What does that mean now when you have school-age children and you're playing co-teacher with this new virtual schooling experience, which has a lot of challenges inherent to it? Just dealing with a pandemic and trying to protect ourselves, protect our families, still function in the many roles as caregivers to family, taking care of ourselves. Something that we know that's unique to our women veteran population is some additional issues. Women that served oftentimes during their military service moved around a lot, and some of them may not have some of the same community roots that somebody who didn't have to move around a lot or wasn't deployed someplace. So we will see some women that are more isolated and don't have those family and friends close by that can help them, especially during a time like this. We also see health needs of our women veterans that have served. They, especially since they lifted the ban on combat and they have gone into combat roles, have an amazing amount of exposures, physical exposures and injuries to their bodies. So over 60% of our women veterans have musculoskeletal issues that they have a service-connected disability for, and also mental health challenges that happen during their time of service. So when we're looking at the emotional and physical needs of our women population, that can add a level of complexity to what their needs are. And then when there's a healthcare issue that affects all women with this pandemic, the gender-specific health screenings like cervical cancer screenings and breast cancer screenings, they don't have the same access. We don't have the same access to those appointments as we used to. So sometimes that's going to cause a delay in care. So we really, the message that we want to get to all women, and in particular our women veterans, is if you have been in a risk category with your cervical cancer screenings in the past or your breast cancer screenings in the past, it is still really important to get those exams now, even though a lot of doctors' offices in the community and at the VA will say, we're going to focus on urgent and emergent cases and not routine. So if you've ever been in a risk category for any of those important cancer screenings, those are considered urgent and emergent. So we definitely want you to still get those screenings. So even though American Cancer Society says it's okay right now because of pandemic to postpone some of the screenings, if there have not been any abnormal screens. If there have been abnormal screens, we are still making sure that people have access to that. So let's just keep that in mind. Another issue is pregnancy during a pandemic. Pregnancy is already complicated enough. A lot of our women veterans might find themselves falling into a high-risk pregnancy category because of maybe advanced maternal age or some of the other healthcare issues with the musculoskeletal issues or some service-connected issues that they're dealing with. So being able to make sure that you have early access to your OB is important. Now at the VA, we don't deliver babies at the VA, but part of the healthcare benefit is pregnant female veterans have access to maternity care, and we connect them with OBs in the community and make sure that they get that care. Because some of the OBs in the community are saying, let's limit some of our face-to-face appointments because they want to limit a mom's exposure, we are making sure that they have access when it is medically indicated to fetal Doppler monitors so that they can do some imaging at home with the help of virtual care with their doctors. So there's some access and care issues that we're able to address, which is really important. We want to make sure that our veterans have all of the important things that they need to deal with their healthcare needs during a pandemic. Something else that I think is really important for us to think about is how what's happening right now financially and health-wise in the community can cause some people to feel more isolated. And we are aware that during natural disasters and pandemics, episodes of intimate partner violence increase, domestic violence increases, child abuse, neglect, food insecurity. So those issues are extremely important, and we have some really great supports in the VA to help assess and address and support those situations. So we ask that our veterans reach out and talk about those issues in a transparent way with their providers at the VA. Every veteran, when they come to care at the VA, they have a PAC team, which is a patient-aligned care team, and they will have their doctor, a nurse, but they also have a social worker, a mental health counselor, a nutritionist, and a dietitian as part of their team. And they're all there to be able to talk about those important issues that impact us all right now during times that have more stress in our lives. So to be able to have those conversations with one another and with your providers is important. Another issue I think that we always want to be aware of and treat with seriousness is the mental health aspects of challenging times. And so to look at suicide prevention as a conversation that we feel comfortable to have with one another. There's this old myth that's still out there, and it's detrimental. If we talk about suicide, we could cause it, but we could make it worse. And that's not true. To be able to check in with people and to ask them questions if they're thinking about harming themselves or ending their life, or feel like they might be better off dead, or that other people might be better off without them. Those are important conversations for us to have. And we have the Suicide Crisis Hotline. September is Suicide Awareness Month, and we'll be doing some virtual events at the VA, and hopefully people will be able to see, you know, the crisis line is for everybody, not just veterans. And then there's also a section that people will indicate if they are a veteran, and then they have that specially trained resource within that, those crisis workers that can address that. So I know I just put a whole bunch of information in my discussion, but I think that having opportunities to highlight some of those important pieces is really valuable. And so I'm here to answer any questions or to talk about those things. And I just touched briefly upon them, but there's a lot more information out there, but I want to be cognizant of other speakers' times as well. So that's what I had to say for starts.
But thank you so much, Kathleen, and thank you so much for really pouring your heart and your soul into really caring for our female veterans. It's really important. And you're absolutely right. When we talk about veterans, oftentimes we only think of the men, you know, but there's so many women that have given so much of themselves and sacrificed their lives, and their families sacrificed right along with them. And so we need to make sure that they are getting the care that they deserve. So thank you so very much for that. And we do have joining us, even though, is she here? Terry Dennison is here. Great. We're so excited to have you, Terry. Lastly, but not least, Terry Dennison is the District Director of the Georgia District Office for the Small Business Administration. Terry's going to address the opportunities that are available for women-owned small businesses through the Small Business Administration. We know that these are very challenging times for all of our small business owners. And so I'm really delighted, Terry, that you're able to speak with us today, to share with us your expertise, give us really good resource information and tools that women that are on with us this morning that own small businesses will be able to really appreciate and benefit by. Welcome.
Well, thank you very much, Congresswoman McBath, and my fellow panelists and the attendees today. Technology was not my friend today, but as my motto is, when plan A doesn't work, go to plan B and keep it moving. And so that's what we're going to do. I'm going to focus on the core offerings of the U.S. Small Business Administration, or SBA, a federal government agency, capital access, counseling and education, and contracting assistance, particularly when it comes to federal contracting. We also have disaster assistance, which you may have heard about more in the context of COVID-19 and some of the special offerings that are being provided by the SBA to assist businesses in that context. But I'm going to focus on the first 3 points with the time we have now. Capital access, basically the SBA does not make direct loans or provide grants for general business startup and expansion to businesses. What we primarily do is we guarantee loans made by private commercial lenders. And we have a couple ways that we do that. Our main offering in that regard is what we call our 7A Guarantee Authority, number 7, letter A. And it's used for a variety of loan and capital access purposes. It can help to support a loan to provide working capital, machinery and equipment, inventory. Also can be used for commercial real estate. In some cases, it may be used to support a loan to refinance existing business debt, which would allow you to increase your cash flow, improve your cash position, et cetera. You can also use that authority for a loan to buy out an existing business, to purchase an existing business, or to buy out a partner who wants to exit the business that you may currently have. People often ask, what does a guarantee do? What does that mean? Essentially, it's giving the lender assurance that if for some reason things do not work out in the loan defaults, they will be reimbursed by the SBA, provided they've done everything they're supposed to do, a percentage of the outstanding balance of the loan, anywhere from 50% up to 90%, depending on the particular use of that 7A authority. Our 504 loan program is one that focuses on fixed asset financing, so mainly commercial real estate, but also long life machinery and equipment, like production equipment, something that has a useful life of 10 years or more. This program is very attractive because it's, one, a fixed rate loan, not variable, which is often the case with loans guaranteed with the 7A program. But that fixed rate base is the treasury rate, not prime, which tends to be lower. So you can lock in a lower rate for 10, 20, or even 25 years, depending on the use of the proceeds for that loan. There is it's usually tied to like an economic development or a development type project. There's a job creation requirement, job creation or retention requirement associated with it. But if the project doesn't meet that criteria, there are other ways the project can qualify. And one of the ways in which it can still qualify is if it's a loan to a woman-owned business there. Apart from the guaranteed loan programs, we have our microloan program, which, as the name suggests, smaller loans. These are provided not by commercial lenders, but by what they call community development financial institutions, CDFIs, which are nonprofit, community mission-oriented lenders. And these loans are up to $50,000. And they cover basically working capital, furniture, fixtures, equipment, inventory, etc. We also have, apart from loans, we also have a surety bond guarantee program. So for those women-owned businesses or any business that's in the construction-related fields, and they need surety bonding to either submit a bid, or if they win a bid, have a performance and or payment bond as part of closing that deal, we will actually guarantee a surety bond for contracts up to $6.5 million. A lot of people don't realize that, so I always like to throw that in whenever possible. Counseling and training. We support a variety of entities that provide free counseling and either free training or low cost or at cost training. We do have what we call the Women Business Center program, which is one of these entities. Currently, we have ACE, Access to Capital for Entrepreneurs, that actually provides not only the microloans that I mentioned earlier, but they also sponsor a Women's Business Center. And they focus on the needs unique to women entrepreneurs and try to present things and communicate things the way that we're most comfortable with, and just really to provide a space where women entrepreneurs feel supported, either in startup or continued growth of their businesses. We have the Small Business Development Center Network, which here in Georgia, we partner with UGA on this. There's 17 locations around the state, 5 in the metro Atlanta area that provide, once again, free counseling and training on a variety of topics related to creating a business or continuing the growth of that business. And then there's SCORE. Used to be Service Corps retired executives, but now it's just SCORE, because you do not have to be retired to be a member of SCORE. It's our volunteer partner organization, people who provide free of charge their expertise, either as former business owners or in some cases current business owners, to assist people in starting and continuing the growth of their businesses. Then we come to the final C, and that is contracting assistance. You know, the federal government in any given year spend roughly $500 billion to acquire goods and services. I think Georgia had about a little over $7 billion this past fiscal year 19. There are goals for various categories of vendors that the federal government has, and one of those areas, of course, is women-owned small business. There's a 5% procurement goal that the idea is that at least 5% of those federal dollars go to women-owned small businesses. So with all these different goals, there's a corresponding certification that's available either through self-certification or you apply and are approved for that certification. And one of those areas would be women-owned small business. Up until recently, there was a self-certification process. Basically, you look at the criteria for women-owned small business. You say, yes, I meet that. You could go ahead and put a bid contract in. And then only if someone had reason to question that status was were you required to put up some type of additional information or documentation to support that. Starting now, we are switching to a formal certification process, which means you apply to the SBA or to a third-party certifier to have them make a determination that you are a woman-owned small business. And that, like I said, we did start a formal process on that. And by October 15th of this year, self-certification for women-owned small business federal contracting will be eliminated. You have to be formally certified. You can find out more information about that at sba.gov/WOSB ready, one word. And you can get more details on that. We also have the 8A Business Development Program, which has been around for probably close to 45, 50 years. It's the closest thing we have in the federal government to a minority certification. Majority of the participants are minority-owned businesses, but there are criteria that allow other types of businesses to qualify and participate in the program. And gender can be one of those bases for why you would qualify. And once again, I'll point you to our website, which can give you more information on how, what the criteria is, but wanted to definitely share that with you as well. And then finally, there's the HUB zone, historically underutilized business zone certification. There's a 3% spend goal for that, that the federal government has yet to meet. And basically it's for businesses in economically distressed areas. And you would apply and be certified by SBA for that. And then finally, apart from certifications, the All Small Mentor Protege program. Basically, it's a program that allows you to enter into an agreement as a small business protege with a large business or even a more experienced small business as a mentor. There's a development plan that's put in place based on the needs of you as a protege. That can include financial assistance, technical assistance, contracting assistance in terms of subcontracting and joint venturing opportunities. And what's really neat about the All Small Mentor Protege program agreement is if you're working with a large business, you can joint venture on a small business opportunity. Whereas normally you would not be allowed to do that because large plus small is large and you would not qualify as an entity for those opportunities. So it's really a win-win in that the small business gets to develop its capacity and expertise and get access to resources it may not be able to access otherwise. And the mentor is able to develop their vendor base, their subcontracting pool through this relationship. So that's kind of the quick and dirty of what we offer in terms of the 3 Cs. Our website for more information is sba.gov. If you want to look at what's going on specifically in Georgia, put a /GA shortcut for Georgia, takes you to the Georgia District Office website. Our Small Business Resource Guide for Georgia is there on the Georgia website, so you can see more about the specifics of these programs and where to access them specifically in the state. You can also sign up for our updates and notices there as well, so you can keep up to date on what the SBA is doing generally and specifically in Georgia. And then to send an email, you can reach us at our general email box, Georgia spelled out, @sba.gov. And I'm glad I was able to share this with you and look forward to your questions and any conversation we may have now. Thank you.
Well, thank you so much, Terry. And I think perhaps Congresswoman McBath is having a little bit of some connection issues. So we'll just go ahead and kick it off with a couple of quick questions. First question goes to you, Kathleen. What services could, some of our women veterans who are seeking assistance transitioning from active duty back into civilian life, are there any, what kind of programming could some of our women veterans look for in that area?
So we have a transition care management team. And what they particularly do is help with those transitioning veterans, and they educate them about VA resources, all of their benefits that they're eligible for because of their service. So one of the things that I think is a really great resource is the Women Veteran Call Center number, because there are so many different VAs, and depending upon which catchment area you're in, the number for the call center, it's a national women veteran call center. So you can call any VA call center, but this is just for women. And I feel like they're more sensitive to maybe some of the gender specific needs. So it's, I should have this memorized, but I don't. It is 1855, and then the letters of VA woman. But the number is 1-855-829-6636. And that is the call center for all information a woman veteran can have about any eligibility and resources. And so when you're transitioning, they have a new program when you're still in the military that starts actually now a year prior to them getting out, where they start to learn more about VA resources, which is good, because at the end, if you wait until the very end, you're so focused on trying to reintegrate back into the civilian world, it can be a lot of information at once. So when people have the luxury of having more time to digest that information, because there is a lot, but at any time, calling that call center number can give everybody very specific information about the programs in their particular area and how to enroll and all of those things.
Wonderful. Thank you so much, Kathleen. And just as a reminder to all of our attendees, we'll be sending around a recording of this meeting at its conclusion, and we'll include the phone number to reach the call center as well, so that you can reference it. We had another question about, if you apply for Medicaid and you've been pending for a significant amount of time, what is available to you, or how could you possibly expedite that process? You can always reach out to the Congresswoman's district office, and one of our staff will be happy to assist you with that. You can reach our district office at 470-773-6330. Laura, I don't know if you have anything to add to that as far as, pending for a long time waiting on Medicaid approval.
Yeah, so you shouldn't be waiting longer than about 45 days. If you are, you should absolutely either reach out to the Congresswoman's office, or there is also a number which I do not have memorized, but the Department of Family and Child Services in Georgia is who kind of is responsible for processing Medicaid applications. So that is a good office to call as well to check on the status of your application.
Fantastic. Thanks, Laura. And just a final question about some of our SBA resources. We had a question about COVID disaster relief funds. So if you have questions about, how to apply for funding through the SBA under the CARES Act, you can give our office a call and we can try and explain those options to you and see how our office can support you in pursuit of that. Again, you could reach us at 470-773-6330. But Terry, would you mind also pointing our attendees toward an online resource for finding out more information about CARES Act funding?
Sure, there's a couple places you can go. You can go to the SBA website, sba.gov, and a shortcut /coronavirus, and that will take you to all the information regarding to SBA and its offerings currently with regards to COVID-19 business assistance. Also, treasury.gov /CARES, as in CARES Act, is the Treasury website. And of course, we've partnered with Treasury in the implementation of the Paycheck Protection Program. So there's information there as well.
Wonderful. Well, thank you so much, Terry. And thank you again to all of our panelists for joining us today. Again, we'll be sending around a recording of this webinar out to all of our attendees. And for any future events or information, you can also go to our website, which is mcbath.house.gov. Thank you, everyone. Have a wonderful day.
Thank you.
Thanks. Bye-bye. Thanks for having us.